Go to the operating room where we will continue to play. But you will be passing family members and patients, so you can be real quiet as a mouse as we go over that. Be good. Does anyone know Owen?
Yes.
A friend of Owen's. So Doug's very good at finding what we call echo windows. So the transthoracic echo, which is through the chest wall, has to go between the ribs, up underneath the ribs, or down from above under the clavicle to find a place where sound can go. Of course, Doug's very good at that, and Owen does have a heart, and here is his heart. And we get somewhat, we can't see the whole thing all at once, so we get to see kind of views of this. So this is the main beating chamber of the heart, the left ventricle. And there are two pumps in the heart. We'll talk more about that in a minute. But this is the main beating chamber of the heart that you would think about in terms of heart function. And each pump has an inlet and an outlet valve. Inlet lets valve blood in, outlet valve lets blood out. So this is the left atrium. The lungs are here, turning blue blood red. Comes into the left atrium relative to the probe. So Owen's going to have to come back and have this valve replaced because you can see a severe leak there. I'm just kidding. So blood would flow through here if this were leaking. So that muscle bends his arm, right? Yeah. Is it bending his arm now? No. No. What do you mean? Did you tell your hand to come up this way? Why did it do that? Put his shirt off. Come on, come on! Put his shirt off. Hit him in the chest. Not real hard. Boom. Does he have a pulse now? No pulse. Okay, we got to get him hooked up here. Let's get him some oxygen. Energy, and every 20 beats or so, you're going to give him a breath. We'll use the bag so you don't have to kiss him. But we want to know what rhythms he's in. So the EMTs are here. We're keeping the circulation going, right? Keep working there, buddy. All right. Come on,
don't let him die.
We're working on it, all right? It doesn't happen overnight. All right. He's in ventricular fibrillation. That means the heart's not doing this. Who knows what fibrillation means? It means bag of worms. It means the heart's doing this. No blood is coming out of it. So we gotta shock him. Shock him. Oh, Jesus. Does he have a pulse? Here, right there. Does he have a pulse? No pulse. Shock him again. Shock him. Oh, Jesus. Pulse. We got a pulse back. We got a rhythm. And we got a rhythm. Now what we're going to do is check his blood pressure. Do you have a blood pressure? You told me He's starting to breathe again. He's coming around. He's picking up. Look at that. You saved his hot tub. Which one was that? So now we're going to be able to save you, right? Because we know CPR, right? But someone in the movie said something about a surgery. If I only knew the cardiac stitch, who was that? Very good. So we're going to start with you here. Somewhere in this tray are holes. Okay, we put some holes in the side of your tray. So if you'll take your tie, my tie went away. So just kind of put your tie. So put your tie through that hole like that. There are more than one hole there, okay? And we're going to come around and we're going to show you how to tie surgical ties, okay? But I'm going to start with you because you want to know the cardiac. Now, there's a difference between a general surgery doctor who takes out appendices and does hernias and all that, like that, and a heart surgeon. Because anybody can operate on a static organ, but try it when it's moving, okay? So general surgeons do what we call two-handed ties, which means you take two hands, and it requires two hands to tie the knot. So you're holding the strings in your 3 fingers. I'll come around and we'll show you. other people will come around and help you. And these are, your thumb and index finger are C's. And so you would hook the string with your index finger, cross them, touch your fingers together, bring the string over, that's why it takes 2 hands, bring it back, and you have a knot. And then we do it the other way. Instead of hooking our forefinger, we'll go with our thumb, touch our fingers together, through the knot, back. That's a 2-handed tie. And you can do it with the other hand as well, but they're slower and they take longer to do, although they're sturdier knots. Now in heart surgery, we don't do 2-handed ties, we do 1-handed ties because we want to be really fast. So then you do like so, okay? Or you can do it with 1 finger like that.
Just take one. Okay. Now put it, I want this one.
2-handed ties. Hold them like that.
With my hole, I'm declaring it my heart.
We're going to help you figure out what's going on there. Alright, so what I'm going to do, you guys here, and then we're going to help you.
And so blood comes in to this guy. And what's this one? You guys want to put your finger in there? What is that right there? It's at the top, and it's on the which side?
Let's go ahead and open
On the right side. Nice job. And the top has to be set where the atrium or the ventricle. Atrium. Very good.
Turn it over the deck if it's this way. Go down your pulmonary artery down.
Nice to see you. Good job.
A cardiologist, and I'm kind of like Dr. Armitage, except the sight of blood actually scares me. So I don't cut people open. We just stick little needles through the skin so we don't have to see too much blood. The angiogram is just an x-ray, is all it is. You guys have seen the heart already, so you basically know what we're talking about. But the arteries that feed the heart are on the outside. And what we typically do in here is we want to see what kind of shape the arteries are in. Are they wide open? Are they normal? Or are they diseased and filled in with the cholesterol plaque material? The arteries don't show up on an x-ray unless you put this little mesh-like tube.
Pictures now, they're fixing the artery.
Were we able to find?
Yeah, there's past. It's making the way around the room.
That's a stent in there. So this looks really big on here. This team will talk about maybe surgery to fix what's going on and put bypasses on. Questions about what we do in here, or how we do it, or is it?
There's an anesthesia guy. Alright, don't suffocate, there's one right there.
That just makes me scared. Seeing the big thing.
So everyone see the TV screen up there?
Yeah.
So on the top green, what is on the top of the screen? Heart rhythm, EKG, right? And in the red, what's in the red? In pink?
Blood.
Pressure, blood pressure. And in the yellow?
Tap.
Pulmonary artery pressure, very good. Remember we talked about the left heart and the right heart being so different? So the pressure on the left side of the heart is 120, and the yellow is the pulmonary pressure. The blue is
Cardiovascular or something like that.
central venous pressure. What's the next blue down? The 95.
Oh my God!
Where's my surgeon?
Right here. No.
All right.
I'm the second surgeon.
If you have to know, there's no blade in this. So we start right here and we go like that. And you do that without touching her? Don't touch her. Right here. Squeeze hard.
That hurts
Chest
my
open.
chest.
Chest is open.
Take a step back.
And now we're going to do things. And now we are going on a heart lung machine. So fix the heart. We gotta take over the circulation.
I just can't take it.
Hands up here. Hands on the field. Hands on the field for sterile. Good. All right. Okay. So instead of putting cannula in her heart, we're going to pretend that's her heart. Okay?
What are we gonna pay?
What is your name?
Harrison.
Harrison. I want you to turn with your hands up. We plant. And grab those lines. I want you to turn the other way. Turn the other way. Grab those lines. They're sterile now. Don't mess them up. Don't drop them. Unwind them. Unwind them.
Unwind it, Harrison. Just unwind it.
Is the pump on? No. Is it all right to clamp the line?
Oh, these things look cool and done.
Now, if you clamp that and this pump was on, you'd explode his pump. You don't want to do that.
Sorry.
Okay, clamp one? Very good. Very good.
Here's some clamps. Oh, you got some?
So I want you to take a clamp, I want you to do that. Do that over here.
Over here?
Okay. So now, don't get Ayana covered in blood, okay? So I want you to cut that. It's going to spread.
It's gonna, okay, cut this.
Use one hand. You've used scissors before?
Just like you're cutting paper. I think it's too late. It's too late.
All right, cut it right now.
Well,
Today. Okay.
I am blonde, so I know I did it, Mars. I'm doing
Hold
it.
that up.
A surgeon only goes so fast. Gosh.
Okay, cut that too.
Michael, we're gonna have to start working on that child's hand
One
muscle.
cut.
New profession.
There.
Dump this blood out right here, like that.
Okay.
And we're
Just
going
like
to hand that off. So what do we say? Where does the big tube go?
Two full parts.
Pulls the blood away. Okay, so we're going to unclamp this and we're going to put some blood in there. So, one second. You got to talk to your perfusionists. They don't know what the hell you're doing. They are unclamping the arterial line.
I'm unclamping this small tube.
Pass your scissors.